Hi guys, Dr. Sammy here with Eastwood Animal Clinic. Thanks for tuning in, thanks for watching. Hope these videos are helpful for you guys. And today we're going to talk a little bit about pregnancy. I was going to use the technical term, pregnant beepity beep. That's the technical term, but pregnant females is what we're going to go with. What we're going to talk about is kind of what you want to do before or when these patients tend to get pregnant, kind of the during, touch maybe on after. We'll see how the video goes. This will apply to dogs and cats for the most part. There are all obviously different breed exceptions, so on and so forth with those things. But just the basic baseline. We're going to talk about those breeds that do not typically have dystocia, which is difficulty birthing. So breeds that Mother Nature usually does a good job on, you don't really need your veterinarian for. What do you all as the owners and caretakers of these pregnant females need to do to give yourself the best chance and stay out of trouble? So first of all, we're going to start with Kay. She went through her heat, got pregnant. We're at the pregnant stage. We've gone far enough in where we know we're pregnant. The pregnancy's stuck. We didn't lose it. No abortions, no false pregnancies, any of those shenanigans. So we're pregnant. And typically here at the veterinarian, we usually like to do x-rays about after 45 days. Here we tend to do them about day 50. The general gestation for dogs and cats will vary a little bit between days 62 to 65 in that general ballpark for both dogs and cats. So once they get past day 45, we'll usually recommend an x-ray. The reason for the x-ray is then you can actually count those fetuses or get a pretty good idea. Here we shoot for day 50 because they're a little more developed and it's easier to count them and catch them. Why is that important for you at home? Well, if you have a Yorkie, they typically only have 1 or 2 puppies. And I recently did a C-section one on a Yorkie that had 6 puppies. And that's a lot of puppies, especially for a normal Yorkie. Ton of puppies, normally 1 to 2, this one had 6. Poor mama. So that's really important for you guys at home, because say she has 1 puppy, has 2 puppies, you don't know if there's more puppies in there, whether it's for a lab, pit, whatever breed we're talking about. That's really important for you to know as the owner, because if you get past about 2 hours and there's more puppies in there, that's a problem. You need to get seen by a veterinarian, and this is starting to turn into a little bit more of an emergency thing. Some things we can do to try and avoid surgery. Sometimes we just go in, a lot of variables with that. But that's why that part's really important for you guys, so that you know if you're having a problem or not. So say I have a lab and we have 9 puppies in there. And you know, she goes in, she has labor, she has the first one out. Typically, they'll vary a little bit. You want to make sure she's pushing a puppy out about every hour. Some moms will go every 30 minutes. Some will push it a little longer to about 1.5 hours. If you're hitting that 2-hour mark, you have a problem. You need to go get seen if you want more live puppies, and it's a lot safer for mom. You have less complications. So keep those numbers in mind, guys. It's very, very important for you. Once we've had all of our puppies and everything's gone well and smooth with that process, you want to really make sure for about 2 weeks before she gives birth and about 6 to 8 weeks after, put mama on a puppy food or a kitten food. You want to have lots of calories and lots of stuff in there. She's producing milk. It takes a lot of nutrition to make milk. People, they do all kinds of different lactating things, from lactating cookies, soy seeds, flaxseed oil, and different things of that nature. So you don't really have to do that with our canine and feline patients. Would it hurt anything? Probably not. Do I have any research off the top of my head to refer saying, yes, we recommend prenatal vitamins and things like that? No, I don't have any. Do I think it's a bad idea? No, not at all. I don't think it would hurt anything, as long as it's not detrimental. Most moms will wean the puppies off themselves, and usually that takes place between 6 and 8 weeks. For those of you who are out there kind of buying pups, be careful. Occasionally I'll come across some breeders that are selling pups, and I'll see the patients and they're not quite doing good. and they're like 4 weeks old, 5 weeks old. That's a big red flag for you all as the owners and buyers. Watch that. A lot of times I'll have those breeders selling them earlier than their 6-week mark. That's the earliest they should be taken away from mom, in my opinion. And when they're getting rid of them at 4 weeks, 5 weeks, I see a lot more of those patients. I see more complications, more issues with those babies because they're just too young to be taken away from mom. So be mindful, be cautious. A little hard for you guys to age them unless you're used to it. I'm not sure the best way you can kind of go about that at home. We use the teeth and size, and we see them all the time, so we got a pretty good idea what they should look like size-wise and teeth-wise for those different ages. So that's probably good for this video. There's a lot that could still be talked about, but I don't want to tie you guys up too long. So hopefully that was helpful for you and interesting and something a little bit new. But we've been seeing lots and lots of puppies here during the COVID pandemic. So be mindful, guys, pay attention, and do the best you can, guys. Take care. Bye.